final project on building a CDI program.
We decided to do our presentation on J.W. Ruby Memorial. It is located in Morgantown, West Virginia. Ruby Memorial currently holds 675 beds, and it currently holds a Joint Commission accreditation, a verified Level 1 trauma center, and a verified Level 2 pediatric trauma center. The total number of discharge days is 32,138, and the total patient revenue is $3,908,143,801. Clinical services include cardiovascular, emergency, oncology, orthopedic, and rehabilitation services, along with neurosciences, organ transplant surgery, radiology/nuclear medicine/imaging, special and wound care, sub-provider units, and surgery. There is currently 449 interns and residents. Currently, our top 3 CMIs are cardiovascular surgery, and neurosurgery. Our bottom 3 CMIs are psychiatry, orthopedics, and obstetrics. Ruby Hospital is currently the number 1 ranked hospital in West Virginia and is accurately named after J.W. Ruby, a World War II vet and owner of the Sterling Faucet.
For department, our CDI program will reside under the HIM department but have its own separate division. CDI reviewers will report directly to their lead, who then reports to their specific manager, who then reports to the CDI manager, who reports to the director. Our executive sponsor will be the CMO, also known as the Chief Medical Officer. The physician advisor will be someone who can play as an in-between the clinical staff, non-clinical staff, and administration. This person will be under its own department, but will have 2 liaisons and 1 lead who will report directly to the CDI manager. All the departments will have a representative on the CDI core team committee. Being able to hear the input from all the departments and those of different positions who would be vital to the CDI program. There will be around 15 reviewers staffed. There plans to be 12 staffed in our inpatient team, with 3 being CDI Specialist Level 3, 5 being CDI Specialist Level 2, and 4 being CDI Specialist Level 1. Our outpatient team would be staffed with 1 being CDI Specialist Level 3 and 2 being CDI Specialist Level 2. The CDI reviewer job titles would be CDI-S, also known as Clinical Documentation Improvement Specialist, and we would have classifications for Level 1, 2, and 3. A job description of a CDI Specialist Level 3 would include the responsibilities of evaluating physician documentation to make sure they are accurately presenting the patient's severity of illness in their medical record and coding it to specificity and accuracy. You will provide guidance to the physician and other ancillary clinical staff on how to perform the best clinical documentation practices. Example of duties will include day-to-day evaluation of inpatient clinical documentations, accuracy and completion of clinical documentations, and proper communication between ancillary staff to ensure they meet the necessary clinical documentation standards. J.W. Ruby Memorial CDI program mission is to improve the overall completion of data entered into patient charts, along with providing physicians the appropriate tools to enact this change. Our vision statement is to be a trusted program that physicians and patients can both rely on to get accurate and up-to-date info.
Our focus areas are cardiology, critical care, and oncology. The training methods are classroom sessions, shadowing experienced CDI specialists, case studies, and regular team meetings. The length of our training program will take 2 to 3 months to complete. Our training will include an introduction to CDI, an overview of APR-DRGs and coding guidelines, common CDI diseases and documentation opportunities, clinical indicators and queries, effective communication skills, best practices for CDI documentation review, and CDI tools and technology. For our training assessment, regular assessments and evaluations will be conducted to assess the effectiveness of the training program, and CDI specialists' performance will be monitored and feedback will be provided to identify areas of improvement. For ongoing training and education, regular refresher training will be conducted for CDI specialists. Monthly team meetings will be held to discuss new concepts, changes in coding guidelines, and new documentation opportunities. For our sample training plan, there will be 10 topic modules that will be completed by physicians and non physicians. Those modules include an introduction to medical terminology, anatomy, physiology, medical ethics and professionalism, medical documentation, medical coding and billing, pharmacology, disease processes, patient communication and education, medical emergency response, and clinical practice. Depending on their roles and responsibilities within the healthcare system, either physicians or non physicians might have this training plan customized to match their unique needs. For people who need more specialized training, it could also be changed to contain more complicated topics. The types of queries sent will be a mixture of open-ended, multiple choice, and yes/no questions. These queries would also be a range from concurrent, retrospective, and clarification queries. The first two would be examples of open-ended, the third would be an example of multiple choice, and the last would be a yes or no.
The type of charts that will be reviewed include those related to high cost or high volume conditions such as sepsis, heart failure, and pneumonia. CDI reviewers may also review charts for complex cases, those with multiple comorbidities, or patients with long lengths of stay. The frequency of chart review may depend on the organization's goal and resources, but typically ranges from daily to weekly. The method of review we decided to use is post-bill review. Post-bill review involves reviewing the medical record after the bill has been submitted for payment. For example, if a patient's clinical documentation does not provide enough detail to support a specific diagnosis or procedure, the coding team may have incorrectly coded the record, leading to a denial. A CDI specialist may use post-bill review to identify these areas and work with the coding team to ensure accurate coding and billing in the future. To manage present on admissions, POA, and hospital-acquired conditions, HAC, the CDI program may use various methods, including educating providers on the importance of POA and HAC documentation, using computer-assisted coding, software to identify and track HACs, and implementing quality improvement initiatives to reduce HAC rates. To measure program effectiveness, data elements such as query volume, query response rate, case mix index, and CDI specialist productivity may be collected. Target metrics for CDI program effectiveness may include increased documentation accuracy, improved coding accuracy, reduced denial rates, and improved reimbursement rates. Reports and dashboards that may be used for reporting program metrics include query metrics, coding metrics, HAC metrics, and financial metrics. An example of a dashboard may include a graphical representation of the number of queries issued by CDI specialists, the query response rate, and query impact rate. Another example of a report may include the HAC rates by type of CDI, by type of condition, and the financial impact of HACs on the organization. The audience that may review these reports include hospital executives, management staff, multidisciplinary committees, and CDI staff. Hospital executives may review financial metrics, while management staff may review coding and query metrics. Multidisciplinary committees may review HAC rates and quality improvement initiatives, and CDI staff may review productivity and query metrics.
Some technology recommendations we would make for this program are white pages and computer-assisted CDI. White pages are used to educate and inform viewers about the leading research/technology currently in the field. Computer-assisted CDI is an AI tool that provides feedback and correct errors in real time compared to waiting on responses from CDI specialists. Future plans for the CDI program include more implementation of these technologies, expanding outpatient CDI to the ED, physicians' offices, and home health. For our future, we'll look to establish clear goals, develop a comprehensive training program, utilize new technology, establish collaboration and communication, monitor and evaluate program success, and stay up to date with industry changes. Overall, a successful CDI program requires a comprehensive and collaborative approach, leveraging technology and continuous improvement.
This is our reference page. It ranges from the official website of JW Ruby Memorial, AHEMA, and our clinical documentation improvement textbook. Thank you.
Thanks.